Your vote matters.
Remember to vote November 8th. There's a lot of statewide and local initiatives that need your voice.
And on November 8th, we need you.
Your voice matters.
Together we can make a change.
Your vote counts.
No olvides de votar el 8 de noviembre.
Make a difference. Let your voice be heard.
Tu voto es necesario.
Get out to vote.
Rock the vote.
You have everything. Take my word, but I heard about the health beat you're gonna be. I just wanna be. Show me how it will be. I just wanna be. Show me how it will be. Listen to the show, the more you'll know about your health, soul, body, and mind. 'Cause the more you know.
Welcome to the Health Beat Show. I'm Dr. Jeffrey Watson, and welcome to the Health Beat Show. Today we're talking about some real health issues that you will have the opportunity to vote on come this election time in November. Many of you are watching our presidential candidates, but there are a lot of other issues that you need to be thinking about locally, issues that relate to your health. You've always heard me say that health is a state of spiritual, psychological, and socioeconomic well-being, and not simply the absence of disease. Today we have joining us two very wonderful individuals, one from the Oakland Community Organizations, and that is in Mr. Andre Spearman, sitting to my right, your left on television. And next to Mr. Spearman is Miss Brittany Chiquita. Did I pronounce that correct?
Chiquata.
Chiquata. Okay. And you are from the American Heart Association.
Yes, thanks for having me.
So welcome to the Health Beat Show. Thank you so much for coming. We're going to be talking some about some of the health issues that will be on the current ballot. One of them, a very confusing issue, and that is Measure HH. Now, many of you may remember some of the tactics that have been used. Proposition 209 is a great example in which the commercials and the ads had you believing one thing, and if you voted one way, it really meant something else. Proposition HH. This relates to what many are calling, quote unquote, the soda tax. Some are calling it the grocery tax, the food tax. Let me ask first Ms. Chiquita from the American Heart Association. What is Measure HH?
Thank you. Measure HH is a soda tax. It's a tax on the distributors of sugar-sweetened beverages, and the language of the ordinance is perfectly clear that this is intended to tax the wealthiest corporations in the world who target communities of color and low-income communities with harmful, addictive products. And the reason why we are imposing this very small tax on soda distributors is because we know that sugary drinks are scientifically linked to type 2 diabetes, heart disease, tooth decay, and a number of preventable chronic diseases. Sugary drinks are the #1 contributor of empty calories to our diets. They are not necessary to live. They have little to no nutritional value. And we are trying to target the product in our diets that are making us most sick.
Okay, and we know that African Americans are folks that we make up 12% of the population, maybe 25% of the deaths. A large percentage of Latinos have diabetes, as do African Americans. Disproportionately, obesity, all the things that you're talking about.
Absolutely.
That eventually doctors and hospitals have to deal with. Now, some have called this a grocery tax. And we saw all these commercials coming on TV that this was a tax that was going to make you pay more for groceries. Mr. Spearman, we know that apparently a similar measure was voted upon in the city of Berkeley, and it actually won in the city of Berkeley. Tell us, is this really a grocery tax? Is it a soda tax? I'm confused.
Well, I think that's the art of the commercials and the art of the communications that people are receiving, is to frame it and confuse folks about what it is. It's very clear that it is a sugar sweetened beverage tax, aka soda. California now, you cannot tax fish. That's a grocery, right? Vegetables, things like that. So the idea is Big Soda has put it out and put the mailers that has pictures of your local grocery saying, oh, it's a grocery tax. So when people become confused, the natural inclination is to say no, and they know that, and so they did it on purpose to confuse folks. But it's really simple and it's clear. It is a tax on the distributors, 1 cent per ounce, sugar sweetened beverages. That's it.
So it's not really a tax to the consumer.
No.
And it's not really a tax that the grocery store will now all of a sudden just start taxing the person from the community, so to speak.
Right. I think that one of the biggest indicators that this is not a grocery tax is that when you look at the mailers that we are all being inundated with, I am an Oakland resident and I'm getting something at least once a week, or when you look at the TV and you look at the bottom of the screen to see who is paying for this, it is singularly the American Beverage Association. You don't see the Dairy Council out against this. You don't see Walnut industry or potato farmers. This is soda corporations who are fighting this tooth and nail, who are making money hand over fist as, like you said earlier, Black and brown people are dying disproportionately from diseases that are caused by sugar-sweetened beverage consumption.
Okay. Now, what does Measure HH do? If it were voted upon, well, is this a similar measure that actually was voted upon and won in the city of Berkeley? And let's maybe give me an example of what happened to your knowledge, Ms. Chiquita, in the city of Berkeley, which voted upon a similar program. I believe it won.
Yes.
And then what
Landslide.
happened? Yeah, and so what happened when it won? What happened? Who got the money? The 1 cent per ounce.
So 2 incredible things have happened in the year since it passed. Number one, sugar-sweetened beverage consumption has gone down in low-income communities. So a UC Berkeley report, peer-reviewed, found that soda consumption is down 21% in low-income communities in Berkeley. And in that same time frame, they found that water consumption has gone up by nearly 60%. So that in itself is phenomenal. And again, it's what these soda companies are afraid will happen in Oakland too. Additionally, you know, the American Heart Association has recommendations for how much sugar you should consume, you know, in a week. As a child, is no more than 3 teaspoons per day, no more than 5 for women, no more than 9 for men. 1 12-ounce can of soda has 10 teaspoons of sugar. Oh, wow. So just with that, you have blown the recommendations completely out of the water. And most people don't know that there's that much sugar in a can of soda. Most people don't know that, you know, 1 can of a soda a day increases your likelihood for type 2 diabetes by 26%.
You know, as a physician, it seems like a no-brainer that we shouldn't be drinking all these sweet drinks and eating too much and gaining weight and then having heart attacks and so on. 1% per ounce tax, it could result in $6 to $8 million a year. Where would this money go, Mr. Spearman, as far as you would know? Would it go? I saw a big article in one of the newspapers that says it will go to the general fund for the city of Oakland, which meant, I guess, it could fill potholes or could do something else. Where
Well,
would
that's
the-
part of the what we call the additional, again, big soda, much like big tobacco, which is another measure that we'll talk about at some point, right? Use it as a way to scare voters into believing that its intended purpose won't happen. So this will go, it does go to the general fund, but within that there's accountability of having a 9-person committee that has a separate account that looks at this money was generated for this purpose. And so you have doctors, you have impacted, me and myself, I'm type 2 diabetic. And so my story is that my mom, growing up in Mississippi, she drank soda like it was water. I'm not blaming my mother for me having type 2 diabetes, right? Sorry, Mom. But she drank it like it was water, and so it became culture. And so I think we drank more sodas than we did water. And I discovered that I was type 2 diabetes when I was 50, and it had reached 600 in terms of the sugar level. And that was like, that's stroke. And so it's a blessing that it didn't happen. But we need the funds in order to do the education around healthy choices. These are the choices that you need to make, because here's the outcome. You, by having this increased level of diabetes in our community, while they have enjoyed great profits, tells you the story. And so we are disproportionate. Our lifespans are shorter, our enjoyment, our health, our wealth, all of that. And in fact, we pay as taxpayers because of the direct impact of the diseases on the county systems. So while soda enjoys great profit, we enjoy the negative impact of sugar sweetened drinks and diabetes and other related diseases.
Mr. Quita, give me some idea of how the city of Berkeley, when this won, how did they make the funding accountable? What is set into this measure that I understand that there will be a committee, a commission, and how does that commission work such that the funding is made accountable, it can go towards education, so towards disease prevention, towards children, schools, towards diabetes. Give me a little idea how that has worked and what the measure outlines.
So as I said, this is completely modeled after Berkeley because it was successful there, and it creates this 9-person advisory committee. In Oakland, just as in Berkeley, this had unanimous support from the city council. The Board of Education supports it unanimously. The California Nurses Association, the Heart Association, obviously, the NAACP. There is both community and political support for this. And to see the overwhelming list of endorsements, you know that there are eyes that will make sure that this money goes where it's supposed to. On top of that,
do people from the soda company get to be on the council to
no.
decide?
So the committee
Does the
is
fast food, big hamburger
they
spot
don't get a voice on this commission.
Tell me who the 9 people
So
are.
the 9 people, there will be 3 representatives from districts most disparately impacted by type 2 diabetes. Then there will be a doctor, a dentist, a parent of someone who's currently of a child who's currently in OUSD, 2 public health professionals, and the 9th person is dental. Thank you.
So there'll be people from the community that will keep this accountable.
Absolutely.
And they will direct it towards areas that might reduce diabetes or work towards reducing cardiovascular disease, reducing childhood obesity.
Yes, I mean, this is a very small tax. And we are asking the soda companies who, as was stated, have made profit off of our disease and death to reinvest in the community. And so this is going into water infrastructure in schools, water access and education in the community, in rec centers. This is also something that's been done in Berkeley, Healthy Black Families.
It's kind of like what smoking, what has happened with cigarettes.
Exactly.
And smoking is that the people who made all the cigarettes had to reinvest in, theoretically anyway, programs that will bring health back to the community.
That's the objective.
That's
I mean,
the objective.
You don't have to go too deeply in a black or brown person's network to find someone with type 2 diabetes. So people know that the sugar is making us sick, that is killing us, and that these drinks, but what they don't know is how closely these drinks are aligned with poor health outcomes.
Okay, we're right here on the Health Beat Show. We're talking about Measure HH. We're going to talk some about Proposition 56, which also has to do with a cigarette tax, right here on the Health Beat Show. I'm Dr. Jeffrey Watson. We'll be right back.
Your vote matters.
Remember to vote November 8th. There's a lot of statewide and local initiatives that need your voice.
And on November 8th, we need you.
Your voice matters.
Together we can make a change.
Your vote counts.
No olvides de votar el 8 de noviembre.
Make a difference. Let your voice be heard.
Tu voto es necesario.
Get out to vote.
Rock the vote.
I'm Dr. Jeffrey Watson. Achoo! Here comes the flu. The flu travels the world every year. You should begin getting the flu vaccine about October. The flu peaks in May on a sunny day. It starts out as a result of a virus called influenza A and another virus called influenza B. Every year the flu travels the world, and because of a chemical change in the virus called a neuraminidase, it changes every year. One year you have the swine flu, the next year the Philippine flu. Oh Lord, what do I do? Well, the vaccine will prevent the flu about 80% of the time, and the vaccine does not really cause the flu. Many of you are very worried about that. And there are other things that you can do. You can take pills to prevent the flu. They're called amantadine, Tamiflu, are just a name of a few of the things that you can do. So, this October, to prevent the flu, get the vaccine or talk to your doctor about one of the medications that can help you to prevent the flu. Remember always that your health is your wealth, and when you have your health, you have everything. I'm Dr. Jeffrey Watson. We'll see you next time.
My name is Deanna Williams. I'm a medical assistant phlebotomist at the James A. Watson Wellness Center, and you're watching the Health Beat Show.
I love taking care of my mom. It wasn't easy at first. She learned how to better communicate her needs.
And you learned how to not ignore yours.
I discovered how to make healthier meals.
And I discovered how much I enjoyed them.
Becoming a caregiver is a learning experience for everyone. Find articles, tips, and tools from experts and others who have been in your place. The Caregiving Resource Center at aarp.org/caregiving.
Your vote matters.
Remember to vote November 8th. There's a lot of statewide and local initiatives that need your voice.
And on November 8th, we need you.
Your voice matters.
Together we can make a change.
Your vote counts.
No olvides de votar el 8 de noviembre.
Make a difference. Let your voice be heard.
Tu voto es necesario.
Get out to vote.
Rock the vote.
I'm Dr. Jeffrey Watson. We're right back here on the Health Beat Show. We are talking about the importance of you going out to vote, because voting is going to impact your health. We have been talking about Measure HH. With me is Mr. Andre Spearman from the Oakland Community Organizations, and also Miss Brittany Chequata from the American Heart Association. Measure HH. Mr. Spearman, just tell me again, what does Measure HH do if one were to vote yes on Measure HH, which some of us know as the soda tax?
Yes.
Others confused as the grocery tax.
Yes.
Measure HH, what does
so
that do?
it imposes a 1 cent per ounce tax on sugar sweetened beverages. And so what it would do is tax the distributors of the sugar sweetened drinks and provide the necessary...
Not the average person in the community, the
right,
distributor.
The distributors. And what that would fund is healthcare prevention awareness, so that eventually what we want to do is have people have better choices and awareness about the choices, because the choices that we're currently faced now with the onslaught of advertisements from big soda is soda is good, and they have the beautiful pictures of beautiful models and superstars and all of that, And so we develop a culture of drinking sodas. But the nutritional value is very limited. So it is a 1 cent per ounce on the distributor. Despite what others may say, it is not a grocery tax. It is a soda tax.
Goes then to a general fund.
Yes,
and the general fund is overseen by a committee that Ms. Chiquata has told us about, that involves individuals from the community, some health professionals, some parents from schools, some people involved with public health, that then helps give advice on where the money should be directed to.
Correct. And we had unanimous support on the City Council and Board of Education, state leaders, local leaders.
And it won in Berkeley and is currently in effect in the city of Berkeley.
It is.
Similar type project.
So we're saying yes on that.
We're saying yes on HH, which is the soda tax.
Yes. And I think that you touched on something really important when talking about how we're disparately impacted by disease, because 1 in 2 Black or Latino children born after the year 2000 is predicted to get type 2 diabetes. This is a preventable chronic disease. And it's no coincidence that Black and brown kids also see twice as many ads for sodas and other sugary drinks as white children, or that a child born in the hills has a 7-year longer life expectancy than a child born in the flatlands.
There you go. It's, again, it should be, as I said, as a physician, a no-brainer, as should be smoking cessation and not smoking. Proposition 56. Proposition 56. American Heart Association talks about smoking all the time. What is the Proposition 56? It's a cigarette tax, $2 per pack.
Right.
And that tax will go to the person who buys the cigarettes?
Yes, that will be on the products.
That will be on the product. And what will happen with that money?
So right now, California is number 37 in the country as far as where we rank with our cigarette tax. So this $2 increase won't even put us at the top. We'll be in the top 5. So this money is really going into cessation programs and as well as prevention, really trying to stop the next generation of smokers from even getting started.
We hear other confusing things on television about it. Oh, it's supposed to help our children and go to the schools and all this kind of stuff. Mr. Spearman, do you have any knowledge, thoughts about all of this confusion that we're hearing on television?
Well, you know, the art of voter trickery, if you will, particularly when we talk about huge corporate interests such as tobacco, or as in the case of the American Beverage Association, their interest is around profit. And so this has been also the art of political persuasion, is when we confuse the voters, then voters simply often walk away from it. But we can't afford to walk away. The $2 tax is about also the negative consequences of tobacco products in our community. So we have people who have lung disease. We have hospitals. Alameda County, their hospital probably has what they would call unfunded liabilities, which is the impact of the increased diseases from a product that has
cardiovascular disease,
has no
cancer,
health value whatsoever for the person who's smoking.
Will the money, though, go into something that will improve the health? Will it actually go into research, treatment, into paying for uninsured people that end up in the county hospital?
Exactly.
Will
that
it
is
be directed there?
That's part of it, is to pay for the education, prevention, and the impact of the unfunded health impacts.
Right,
of
part
tobacco.
of this is going into fund Medi-Cal patients.
Yes, exactly. Low income, and they are most likely to be the ones impacted and persuaded. If you look at every magazine and Jet magazines back in the day,
I hope they could increase the Medi-Cal
rate.
Yes, Medi-Cal, absolutely.
Yeah. Well, because it's so hard. It's so hard for physicians to be able to take care of the patient population.
Absolutely.
And then the last thing it's going to do is going to discourage you from wanting to pay so much money to buy some cigarettes.
It's good for your health.
It's good for your health.
And your wealth.
Because your health is your wealth, and when you have your health, you have everything. Exactly. This is Proposition 56, which increases the cigarette tax by $2 per pack.
Yes.
with an equivalent increase on other tobacco products, including e-cigarettes.
Yes.
Oh my goodness.
Oh,
Can
so
we talk about that?
e-cigarettes going to be
Yes,
on it too?
because
talk about that one?
in May, the governor signed legislation making e-cigarettes technically tobacco products.
I want to speak about the insidious nature of that one.
Uh-huh.
The e-cigarettes.
That's supposed to help you stop smoking.
E-cigarettes, now they have the liquefied version of them in Fruit Loops, blueberry, strawberry flavor. Now we have flavored, liquefied electronic smoking devices. So now you can have flavored smoke. It was bad enough just to smoke, but now we've increased the advertisement with all the different
So that
popular
may make
names.
young people want to.
Right, Sugar
use the
Smacks or
product.
whatever name they may want to call
And
it.
to your point about it helping
Exactly.
people quit, UCSF actually found that this is helping people start.
E-smoking is.
E-smoking,
Yeah, that is
yes.
essentially
So-
a gateway to traditional
So this
combustible
will be
cigarettes.
a tax also then on e-smoking.
Yes.
And certainly
Yes.
we got to have more education about this because
Yes.
I thought that the e-cigarette was then supposed to help you stop smoking.
No, research finds that it actually encourages people to go smoke harsher things, so combustible cigarettes.
Oh,
It's the
my
vapors.
goodness. Okay.
Taste
We're-
good, smell good.
We're talking about
So the hit isn't enough, and then you want the real thing.
Proposition 56, which is
Yes.
a $2 tax. So voting yes on this would add a $2 per pack
Yes.
tax to cigarettes and e-cigarettes
Yes.
used towards improving the healthcare programs, education, smoking prevention in our
Correct.
community, particularly those of us who are at greatest risk. We have had with us right here on the Health Beat Show, Miss Brittany Chiquata from the American Heart Association. Thank you for coming.
Thank you.
And we have Mr. Andre Spearman, who is also from the Oakland Community Organizations. Get out and vote. These are important topics. These are health topics. You know, I'm here not just because, you know, you can see me later. See me now and prevent it. See me now and prevent it. Because we always say that your health is your wealth, and when you have your health, you have everything. I'm Dr. Jeffrey Watson. Get out and vote.
You don't have to take my word, but I heard if you have your health, you have everything. Take my word, but I heard about the health beat you're gonna be. How you wanna be? Show me how you will be.
Your vote matters.
Remember to vote November 8th.
There's a lot of statewide and local initiatives that need your voice.
And on November 8th, we need you.
Your voice matters.
Together we can make a change.
Your vote counts.
No olvides de votar el 8 de noviembre.
Make a difference. Let your voice be heard.
Tu voto es necesario.
Get out to vote.
Rock the vote.